Early signs of disease are almost never loud. They don't show up as emergencies. They don't stop your life in one moment. Most of the time, they quietly blend into your routine, and that's exactly why so many Americans miss them. In the United States, life moves fast. Long work hours, stress, responsibilities, constant screen time. When the body sends small warning signals, most people ignore them and move on. They assume it's stress, aging, or just part of modern life. But many serious health conditions begin with symptoms that feel minor, normal, or easy to explain away. This isn't about fear. It's about awareness. Understanding your body early gives you more control later. One of the most common early signs people ignore is constant fatigue. Not normal tiredness after a long day, but deep exhaustion that doesn't go away. You wake up tired, coffee barely helps, and rest doesn't seem to fix it. Many Americans accept this as normal adulthood. But long-term fatigue can be an early sign of heart disease, diabetes, thyroid problems, autoimmune conditions, depression, and other chronic illnesses. Energy levels don't drop for no reason. When tiredness becomes your default, your body is asking for attention. Another early sign that often gets ignored is unexplained weight change. Losing weight without trying or gaining weight without changing your habits is not something to brush off. People blame stress, metabolism, or age. Sometimes that's true. But unexplained weight changes can also signal hormonal imbalances, digestive disorders, mental health conditions, diabetes, or cancer. Weight changes are not just about appearance. They're information. Shortness of breath is another warning sign many people overlook. Feeling winded walking upstairs, carrying groceries, or doing tasks that used to be easy is often blamed on being out of shape. But breathing should not feel like effort. Shortness of breath can be an early sign of heart problems, lung disease, anemia, or circulation issues. If breathing slowly becomes harder, that's not normal. Frequent headaches are also commonly ignored. Everyone gets headaches, sometimes. But when headaches become more frequent, stronger, or different from what you're used to, it matters. Ongoing headaches can be connected to high blood pressure, dehydration, sleep disorders, stress-related illness, or neurological problems. Taking painkillers repeatedly may quiet the pain, but it doesn't solve the cause. Digestive issues are another area where Americans normalize discomfort. Daily bloating, constant heartburn, frequent constipation, or ongoing diarrhea are often treated as normal. People joke about having a sensitive stomach. But chronic digestive problems can be early signs of irritable bowel conditions, inflammatory disease, food intolerances, liver issues, gallbladder problems, or stress-related illness. Your gut plays a major role in immunity, mood, and overall health. Numbness or tingling in the hands or feet is another sign people dismiss. It's easy to blame posture, sleeping wrong, or phone use. But persistent numbness or tingling can be linked to nerve damage, diabetes, vitamin deficiencies, or neurological conditions. When these sensations keep coming back, they deserve attention. Mood changes and brain fog are also often ignored. Feeling unusually anxious, irritable, depressed, forgetful, or unable to focus is often blamed entirely on stress. Stress is real, but mental changes can also be early signs of hormonal imbalances, thyroid disorders, vitamin deficiencies, autoimmune disease, or neurological conditions. Mental symptoms are physical signals too. Pain that people get used to is one of the most dangerous things to ignore. Chronic back pain, joint pain, chest discomfort, or constant aches are often accepted as normal, especially with age. But pain is not something the body produces without a reason. Long-term pain can be linked to inflammation, heart disease, autoimmune disorders, or musculoskeletal problems. Pain that stays deserves evaluation. Changes in sleep are another early sign people overlook. Trouble falling asleep, waking up often, sleeping too much, or never feeling rested can be signs of heart disease, hormonal imbalance, mental health conditions, or immune system issues. Sleep is when the body repairs itself. Poor sleep often leads to poor health. Frequent infections or slow healing can also signal deeper problems. Getting sick often, catching every cold, or noticing wounds that take a long time to heal may indicate diabetes, immune system weakness, nutritional deficiencies, or chronic illness. A struggling immune system is a warning sign. Changes in appetite or thirst are also important. Feeling extremely thirsty, losing interest in food, or craving sugar constantly can be early signs of diabetes, hormonal imbalance, depression, or metabolic disorders. Hunger and thirst signals exist to maintain balance in the body. Skin changes often reflect internal health. New moles, changes in color or texture, yellowing of the skin, persistent rashes, or unexplained itching can be signs of liver disease, autoimmune conditions, infections, or cancer. Skin is the body's largest organ and often shows what's happening inside. Chest discomfort that doesn't feel sharp or dramatic is another sign people misinterpret. Many people expect heart problems to feel sudden and intense. In reality, early heart symptoms often feel like pressure, tightness, burning, or indigestion. Especially in women, heart disease symptoms can be subtle and easy to dismiss. Chest discomfort should never be ignored. Memory issues are another early sign people joke about. Forgetting names, losing focus, or struggling to concentrate is often blamed on aging. But memory changes can be linked to sleep disorders, vitamin deficiencies, depression, neurological disease, or chronic stress. Cognitive changes are not always harmless. Changes in bathroom habits are also important signals. Frequent urination, waking up at night to urinate, or changes in urine color or smell can be early signs of diabetes, kidney problems, infections, or prostate issues. The body's waste systems provide valuable clues. A persistent cough or voice change is another symptom people ignore. A cough that doesn't go away or hoarseness lasting weeks is often blamed on allergies or weather. But persistent coughs can be linked to lung disease, reflux infections, or cancer. Duration matters. Sometimes the earliest sign is simply a feeling that something isn't right. No clear pain.
No obvious symptom.
Just a sense that something feels off. Doctors hear this often, and many serious conditions start exactly this way. Your intuition about your own body matters. Here's a simple rule to remember. If a symptom lasts for weeks, gets worse instead of better, interferes with daily life, or feels unusual for you, it deserves attention. Early detection doesn't just save lives. It reduces suffering and improves outcomes. This message isn't meant to scare anyone. It's meant to remind you that your body communicates constantly. Most diseases don't start loud. They start quietly, waiting to be noticed. Listening early is not weakness. It's awareness. It's responsibility. And it's one of the smartest things you can do for your future. If something feels off, don't wait. Handle it early. Your body is always talking. The real question is whether you're listening.